Hello, my name is Sonia Gobet, and I am the co-founder of the Ataxia of Charlevoix-Saguenay, which is based in Montreal, Canada. The Foundation's mission is to finance treatment for this rare neurological condition. I set up the Foundation back in 2006 following the diagnostic of my two children for this type of ataxia, which is often referred to under its acronym RSAX. Back in 2006, the SAX gene had been identified, but there was absolutely no research done in Canada or elsewhere in the world. At the time, I knew nothing about launching a foundation, nor about research. Yet, in retrospective, creating this foundation was probably the best thing we did under the circumstances. RSAX is the second most common recessive ataxia in the world. It is a rare but universal condition. The Foundation has its own patient registry, which now undertakes 35 countries where people have been diagnosed with this condition. The Foundation currently finances several research projects to find a treatment, either in Canada or elsewhere in the world. We are always on the lookout for partners to partner with us to move along the science to finding a treatment for this type of ataxia. Several projects are underway, and one of them is conducted by Dr Benoit Gentil from the University of McGill in Canada, Montreal. The Foundation finances his research project now for several years, which is on gene therapy. Dr. Gentil will talk to you a bit later about his gene therapy for RSAX, the hurdles and the promising that lies ahead. Should you wish to contact me, Sonia Gobet, you may reach to me at any time at my email address sgobet@rsax.com or visit our website for more information. Thank you for your attention.
Hello, I'm Benoit Gentil, and I'm going to present you our gene therapy project developed at McGill for the RSAX Foundation. So what is RSAX? RSAX is a complex neurodegenerative disorder with a triad of symptoms. And you have an ataxia, you have peripheral neuropathy, and you have some spasticity. In addition to these symptoms, you have several other clinical manifestations, but this triad of symptoms is characteristic of RSAX, of autosomal ataxia, recessive ataxia of Charlevoix-Saguenay. So RSAX is caused by loss of function of a giant protein called saxin. This saxin is encoded by a gene called saxin and was described to be mutated in RSAX a long time ago. And this mutation causes mainly this degenerative disorder. So RSAX is a monogenic disorder. And this type of disorder are usually very adaptable for gene therapy. And that's the goal of our laboratory. So we have developed this gene therapy, and now the problem with the saxin gene is saxin is a gigantic gene that you need to shrink down, to cut into smaller pieces, so you can integrate into current gene therapy vectors. So RSAX pathology at the cellular level is defined by different abnormalities. You have protein aggregation, an abnormal calcium homeostasis, an imperaxonal transport, synaptic dysfunction, and Purkinje cell loss. But one of the main characteristics is the formation of intermediate filament bundling, which are basically cytoskeleton elements that coalesce into forming a big filament. So intermediate filament bundle is a very robust biomarker of saxin deficiency and is present in fibroblasts derived from patients or in neurons derived from a mouse model of RSAX and are characteristic of the lack of saxin. So we have designed a gene therapy to target the molecular mechanism of the disease particularly aiming at disrupting this abnormal intermediate filament bundling. This is an advanced gene therapy mechanism, and also the formation of a gene therapy using adeno-associated viruses helps to precisely deliver these new technologies that we designed. So we have tested our gene therapy product in vitro using patient-derived fibroblasts or primary cultures of dissociated spinal cord and dorsal root ganglia of mouse model. And using the gene therapy product, we then assess the effect of this gene therapy product on the disappearance of intermediate filament bundle in vitro. Using this gene therapy product, we have shown that we can resolve intermediate filament bundle in vitro. And then we tested this gene therapy product in presymptomatic mice by a single injection. Following this single injection, we follow the phenotype of the mice, and especially if the gene therapy product could resolve some of the characteristic, the symptomatic characteristic of mice, like the ataxia gait or the muscle weakness. So in conclusion, we have designed a gene therapy product that can target a key event in the RSAX pathogenic cascade. And using this gene therapy product, we show that we can resolve this biomarker called intermediate filament bundle in vitro. And when administered to mice, this gene therapy product was able to resolve and delay the onset of some key characteristic and key symptoms in the RSAX mice model.